Morning, we have with us Dr. Sulagna, the Associate Professor from the Department of Anesthesiology, Critical Care at AIMS, Delhi. We welcome you to the Natco Pharma Specialty Criticon Studio this morning, and we look forward to your advice for the young generation doctors in the space of critical care associated with bacterial resistance. My first question to you is, how do you foresee the changes in critical care management?
The most important challenges that we face now is the emergence of carbapenem's resistance, multiple different types of resistance that are coming up in the nosocomial infection associated bugs. And it's a challenge because with our limited armamentarium of antibiotics, with new molecules not it's not so easy to get new molecules every year or every decade. So it is becoming very difficult because and the widespread resistance organisms in our clinical practice that we get to see. Uh, these are one of the most important challenges that we are facing now, and I think we have to cope up with this.
What would be your message to the young doctors out there in ICU care of patients? How can they enhance better care?
I think the future of diagnostics, microbial diagnostics will have to be point of care, more molecular diagnostics. We are incorporating polymerase chain reactions, multiplex PCRs, to identify the resistance mechanisms much before we get a culture report or MIC values. So these are the newer techniques that we are incorporating into our clinical practice. I think that can enhance our effective antibiotic therapy in patients.
Great. What is the prevalence of carbapenem S in your practice?
So in my practice, I see carbapenem is in around 70 to 80% of the bugs that we get. So it's a big challenge that we have to face.
And what treatment options
Yes.
would you suggest?
So we are in many clinical samples now we are able to do a multiplex PCRs. If we identify resistance patterns like presence of NDM, metallo-beta lactamases, and other carbapenemase enzymes, then we for Enterobacteriaceae we go for antibiotics, higher antibiotics like ceftazidime, avibactam, aztreonam. Also, we for bugs like Acinetobacter, where we have carbapenemase resistance, we go for drugs like sulbactam. So we can titrate effectively and modify our antibiotic therapy within the first day itself, with 24 to 48 hours before we get proper cultures or the MIC values. Uh, Broad spectrum along with a targeted pattern of handling the antibiotic resistance.
Dr. Sulagna, thank you so much for your time and sharing your insight. We wish you all the best in your practice. Thank you for being with us.